Hello, lovely viewers. This is Just Greatness. Welcome to my YouTube channel.
Hi there, my name is Dyllon Ibanez. I'm currently working in Ipswich Hospital, and I am an international nurse coming from the Philippines.
Lovely. Dylan,
Mm-hmm.
it's such a great privilege to have you on the channel today. Thank you
No
so much
problem.
for your time. I don't take it for granted. Anytime anybody, gives me the opportunity to interview you on this channel, I really appreciate it because time is money, and I'm so grateful
Sure.
for answering my invitation. Guys,
But
you know
yeah,
what?
thank you.
Dylan is one of the people that I met in the UK in my early days here, and he's been a very good friend. He and Alvin, I'm sure Alvin will be on the channel very
Yeah,
soon.
no
So,
problem.
so that we don't waste or take too much of your time, let's go
Uh-huh.
straight into the video. So my first question to you, Dylan, is how did you start your whole process? Did you have to clear yourself with your home country, NMC? I don't even know how your home country NMC is called.
Mm-hmm.
Yeah, so how did you start the whole process migrating to the UK?
If I could remember everything, which my memory isn't that good anymore, but yeah, it started with a dream of coming here. So
Love.
ever since when I was a child, like having to listen to certain bands such as Westlife, it really made me like a fan of this place.
Yeah.
Um, Seeing some picture, and yeah, it started with that. And during the pandemic, I remember it was one of the worst time probably, and I realized how really important it is to be a nurse. And yeah, it gave me yeah, it started from that. In our country, it's not NMC; we called it PRC. And then yeah, I
PRC.
PRC, yeah.
Okay, and
And
what's the
then
full name, please?
hold on, Professional Regulation Commission.
Okay.
So it's
Okay.
PRC. I had a dream, and I took an English exam and a certain another exam, which is a nursing exam. And then yeah, I had an agency, and the agency helped me to come here.
Lovely. So you
Mm-hmm.
were also, eligible to go through agencies because some of us from West
Mm-hmm.
Africa and some other African continents, we are not allowed to go through
Really?
agencies because of the red,
Mm-hmm.
the red list mist, the red and the amber list thing. So you are
Mm-hmm.
blessed to have
Oh,
been able to go.
I didn't know about that actually. Mm-hmm.
Wow. Wow. That's wonderful. So, guys from the Philippines, you are free to go through agencies. And I'm sure Dylan is going to help us with the agency that he used. And maybe if he has
Yeah.
names of other agencies, we can share the
Mm-hmm.
link in the description section
I
below.
think there's a several agency that really helps people to go to UK. I would
Wow.
say around 70. Yeah, I have a list,
70.
yeah, in the Philippines.
Wow.
And I think I applied with everyone. It's just that even now I still have like a what do you call this, job opportunity, or I mean they still send me some email
Oh,
about the
yeah.
vacancy, but I'm already here, so yeah.
I don't need it. That's wonderful. So, the next question is what document did you need? What document did you use
Mm.
in the process? Right from the beginning with the agency till you got into the UK.
Okay, so there's a lot actually, but I think I will just mention the important ones. I don't
Okay.
know what's what do you call this, in your place, like it's not the same, but I would say the most important thing is to have your certificate of experience. So
Mm-hmm.
this will really like tell the what do you call this, the employers that you have work as a nurse.
Yeah.
I don't know what how many years do they what's this need right now, but mine has like 3 years, something like that. And another is an English exam. If you're not a English, if your dialect isn't English as like the other countries like USA or Australia, you'll be
Yeah.
needing this. So I took an IELTS exam, which I find really difficult compared to the other exam that I took.
Okay.
uh, I would say another is your record, saying that you don't have any criminal record or something like that.
Okay. That's the police
Uh,
clearance or let's say TDS.
yeah, police clearance and we in our country it's NBI clearance, so I had those as well. What
Hold
else?
on. Did you say apart from the police clearance, you had another clearance too?
Mm-hmm. It's an
Wait,
NBI thing, national. Forgot about the meaning, but it's like a police clearance basically.
okay, so
So
that
you
means you need
need
to
to
clear
go.
yourself twice in your home country. It's
Mm-hmm.
two
Yeah.
different clearings. Okay.
Mm-hmm. But I think you can use either both. But in my case, I had them both just to be sure.
Okay.
And another is I think is this is just during my time because pandemic is really like a
Mm,
big thing. So I need to have like a vaccine certificate as well.
okay.
And then the other ones the agency will help you out. There's a lot of them, but the agency will help you out. Those are just those are, I mentioned is the important ones that which you can have on your own. I mean, you can do it on your own. Whereas the other ones, you need the agency probably to help you out if you go for an agency. If
Yeah.
not, I think you need to really have a research on it. But
Yeah.
yeah, those are the important ones, I would
Okay.
say.
And basically your passport. The
Yeah,
passport is
exactly. Passport. I forgot about that, but yeah, you need to have a passport.
okay.
Indeed.
So does it mean that some people from the Philippines choose to do it without agencies? Like they choose to do the whole process themselves individually.
With other nurses that I know, basically, I think 80% uses agency because it's just more convenient for you because there will be someone who's gonna guide you,
Yeah.
tell you what to do, where to go. But I would say some of them choose to have, I mean, choose to don't go. I mean, choose not to have agency. Basically, it saves them more money, although you don't need to pay a lot. I mean, you don't need to pay on having an agency, but
Mm,
being a direct one, I mean, applying for a direct one would really be saving money, I guess. I'm not so sure, but yeah, some of them decided not to go for an agency, but in my case it's just easier for me because I didn't pay much about my agency. Yeah, they
yeah.
will just guide you, and I think the employer will be the one who's gonna pay them.
The agencies. Okay. That was going to be my next question. If you had to pay
Hmm.
the agency and you've answered it, you didn't have to pay anything. So
No
they
money,
helped
no.
they helped the NHS to get you. So the NHS pays them.
Yeah, exactly. I think that's how it goes.
Yeah.
And yeah, you just need to select which one because like not all agency has a contact in here.
Mm,
So some of them are basically connected to hospitals in London. Some of them are outside London or on countryside. So you just need to find which agency is best for you. So yeah.
okay. Okay. So that means that the agencies are kind of grouped under the regions in the UK.
Yeah,
There are
that's right.
agencies that are basically based in London, others based in
Mm-hmm.
England, and all of that. Okay.
Yeah.
Okay, lovely, lovely. So when you were talking about the documents you needed, the exams that you wrote, you spoke about IELTS. I hear
Mm-hmm.
that in some countries it is only IELTS that is available, or let's say for example, it's only OET. And if you
Oh,
have
you
to
see.
write any other one, you have to travel outside the country, go to another
Mm-hmm.
country to write it. How is it like in the Philippines? Do you have
Uh,
access to both IELTS and OET to write? Do you have that luxury to choose?
yeah, I think I would not say we're lucky, but during that time I would say it really is difficult.
Hmm.
So basically, during my time, I remember having to travel to different cities because the one on my city where I live, we don't have IELTS or OET exam, so I need to travel by a plane
Oh,
to another city. I think I
really?
took IELTS twice. I failed in the first one, and the second one I succeeded. But in return, I had COVID because of it. I don't know.
Oh,
I think I told you about that. So I actually spent 10 days on a school with stranger just to have like.
oh,
But basically, those are part of my journey, and I would say it it's something
and
that
you made it.
really
You made it.
really made it special because yeah,
You know what?
it,
Sometimes
it's a big gamble, to be honest. I could
I'm
have
telling
stayed
you,
and wait for the pandemic to be over, but at that time I'm really like I'm gonna go for it. No matter what happened, I will go for it.
and
So
you went for
yeah,
it. Sometimes
yeah,
when people see you, like, Dylan has arrived, he's in the UK, he's working in the NHS, they don't know what you have gone through. Look at
exactly.
that. Look
Hmm.
at that. You had to write the IELTS twice, travel out of your town, your city, go write it twice. And then after it, you had COVID.
Yeah. I
Congratulations.
actually what's this took they said during the examination. I mean, no, the what do you call this? So I went to the doctor. They said during that time when I took the exam, because I couldn't sleep. I thought it's just me being anxious or something, but it turns
Yeah.
out I'm having the symptoms of COVID, and one of it is insomnia. And
Yeah.
they didn't have. I had like, I don't know. I was awake for two days, and I took the exam on that day. But yeah, luckily I think it's just for me.
Yeah.
Oh, but it really is something.
For me, I wrote the IELTS once, but I had to write the CBT twice. And then
Mm.
right after CBT, I was admitted to the hospital because I was dehydrated. I was just too stressed
Yeah,
out.
I think you
Again,
mentioned
oh
it.
my god,
I think
this
you're still working
mental
at that time, right?
stress.
Mhm.
And we are here now. We are here now.
Mm-mm. That's the
So
good
my
thing.
next question, Dylan, was I know you went through the agencies, all right?
Uh-huh.
So I don't have, experience, or I don't know how it is done when you are going through agencies. So how did you apply for the jobs? Is it that the agencies apply for the jobs on your behalf, or you apply it and then the agencies helps you to get your documents together? How did you do the job application?
So basically, I think it really depends on an agency. Mine is called ABBA. It's just like the band ABBA. So I'm
Mm-hmm.
mentioning it now. So with my experience, basically they will ask for certain documents.
Yeah.
They will ask you for a certain style of application. So basically, I think you're submitting it to them, and they are the ones submitting it to the NHS or to the trust. So
Wow.
basically, it's much easier actually, because there will be someone who's gonna guide you.
Yeah.
Like, this is the style, this is how you will tell yourself. Like, this is the requirements that you need. So basically, I didn't do much. Like, I just submitted. I have an agent. So it was really nice. She's really nice, and she works really fast, and she replies most of the time. Like, apart from she is pregnant that time, but she's been really accommodating to me. Like, I will just ask them for requirements. How do I do this? Where do I get this? And she will help you out. She's really nice.
That's wonderful. That's great. So your main ish was to search for the agencies and make sure that you apply to all the agencies. You get
I
it.
would say, yeah, in my case, I applied for everything just to see the options that I have. And so far, I think during that time, yeah, I took this. I mean, I took SNF, which I'm working right now, because basically their offer is really nice. And I think that's the
That's my
reason
next
why you
question.
you took
Why
this
did
as
you
well.
choose why did you choose the trust in which you are now?
Oh,
'Cause
yeah.
you had
Actually,
so how many, in fact, let me ask this first. How many
okay.
job offers did you get? And why did you choose the one that you are with now?
Mm, so basically, I remember having to have an interview with a lot of um people from different places. I think I had like a lot of, I couldn't count them, but I would say some of them are really nice. Like, I would say around 5 to 6 offers
Nice.
from different places.
That's
Like, basically in central London. The other thing that I really would consider was Cornwall, just because of their beach there. But it's really far. That's my concern.
yeah.
It's really far. Like, it's on the edge. Like, you're in the South Park.
Yeah.
But yeah, with what I'm working right now, I think what really stands out is their offer, and it's really nice. At that time, I'm really like being wise, because like, I think the best part with their offer is they're offering free reviews for OSCE. Because when
Yeah.
you come here, you won't be, yeah, you need to work as a healthcare assistant first before you take an OSCE exam and then
Yeah.
become a registered nurse. So with what SNP offers, they will help you review for free, and they will also shoulder your exam for 3 times. So
Wow.
that's really stands out. So with other ones, they have like free, what do you call this, review, but they will just shoulder your exam for once. And also the other thing is, I'm saying this because I'm being honest, is their
Yeah.
offer. So when you come here, they will automatically give you £1,000 just for you to start. And with other places, it's not like that. And
Yeah.
they will just give you like 250 or £500 for you to start. In here, they will give you £1,000, but that's not for free. You will
Wow.
it will be deducted on your salary for a year. but it really helped me when I came here. So
Wonderful.
the I would say the trust that I'm having has really good offers. So
Wow. So, guys, you see, you are going to get more offers. There are instances where you get three, four, five offers. Weigh them. Look at the offer properly and choose well, just as Dylan is saying, because you are going into a new country. Some of us came here without having, family members around
that,
and all that,
that's
and you
really
don't
true.
want to jump into a foreign land with nothing. So read through your conditional offer letters well. Look at what the trust is offering, and then make your comparisons and your choices wisely so that you don't get yourself fixed.
Yeah, and I would add as well is the location.
Mm-hmm.
The reason why I choose this one is it's just 1 hour and 30 minutes to London, which is the central ones. Because
Yep.
if you're gonna go for like I would say Birmingham or somewhere far, it would really
Yeah,
be difficult for you to travel if you're going home back to the Philippines or
of
going back to
course.
your own country, or if you
Yeah.
just wanna have fun, like go to London.
Yeah.
So that's what I consider. I don't wanna live in London at that time just because I thought it's really crowded and it's really
Yeah.
busy at that time. But right now, I would say, yeah, I had a good decision because I could just travel whenever I want. Like
Mm-hmm.
that would cost you like around how many pounds, but you will have to. I mean,
At
you will
least,
arrive
yeah.
in London in like 1 hour and 30 minutes. So
Yeah. And you are in London, and then you can always
Mhm.
come back. And one of the reasons why um I kind of talk about reading the job offers and also comparing the standard of living, because people go
Yeah,
like,
yeah,
oh, in London the salaries are
mhm.
more, but the standard of living, especially the accommodation, is very, very expensive. So if you are coming first, if you have the luxury, guys, of choosing between trusts, of choosing areas to work in, you can consider that as well. But there are some instances where you don't really have a choice. All the offers that you got are in London, all the offers you got are in Liverpool, and you have no choice than to choose to go to wherever
Yeah.
it is.
But if
But
you have
if
the
you have the
choice,
luxury,
really
choose
weigh
well.
them. Yeah.
Yeah, choose
Mhm.
well. So, Dylan, how has it been so far working in the NHS? Because I know some of your people, some of the nurses are coming to work in the care home, the private sector, but you are working in the NHS, the government sector. How has
Mhm.
it been? Are you
So far,
enjoying
it's
it?
really amazing. I've been enjoying it. Like I would say, the best part of being here is you have a work-life balance.
Mm-hmm.
So in the Philippines, it's not like that.
Oh,
It's
really?
really hard for you to like have a straight what do you call this off in here. You would only work for around 37 hours a week. So that would be 12 hours.
Mm.
I would say 3 to 4 days a week of work,
Yeah.
but that's 12 hours. But yeah, so far it's really been nice. Like I met so many people. The ward that I'm working is Brantom ward. It's an assessment or medical ward. We're a lot in there. It's mixture of British,
Wow.
Indian, and Filipino as well. There's a lot of
Wow.
them, and so far, yeah, it's been amazing. Like the
It's
people I'm
amazing.
working with, that's the most important thing. Because like
And
even
I'm
though your
very
work
happy
is,
for you.
yeah, having to work with very good people would really help your job.
Yeah,
Promise.
I'm very
That's
happy for you
been nice.
because there are people who come into the country and they suffer, racism stuff, and
Yeah, I didn't experience those.
I'm
And my
very
ward,
happy.
it's really nice.
You are
People are
blessed.
really yeah, people are really nice. They would really help you out. But yeah, it's not always been like that. I mean, probably with other places there would be issue, but I'm so lucky to have my ward, so I'm
Bless
happy working
you.
there.
You are blessed. I'm so happy for you, Dylan.
Thank you.
And so, um, I think, yeah. So Dylan went through the agency route, just applied to the agencies, and they helped him get, interview offers here and there.
Yeah.
About 5, 6 interview offers, had to choose the best area to live in based on his own, choices and decisions. And then he ended up somewhere in England and he's enjoying working in the NHS because the support is great. So, Dylan, your last words to my viewers. What would you want to tell my viewers?
So I don't have much word to say, but I would say always follow your dream because with me, I think it started with that. I would
Mm-hmm.
not come here without any plan. So if you have a dream, just chase for it. And yeah. things will work out. I
Wonderful.
promise. You just need to work hard for it. Pray, of course. Have God with you, and nothing's impossible.
So,
Yeah,
and to add on to that, there is no dream that is not achievable. Dream big.
true.
And the
Yeah, dream
fact
big.
that you are doing it doesn't mean it's going to be easy. Dylan had
It's
COVID after his IELTS. He wrote IELTS twice, but he is still here. So push, keep at it, keep going, and you will get
mm-hmm.
there. If this
True.
is your first time meeting me on this channel, this is just in greatness. On this channel, I share information about migrating to the
Mhm.
UK. As an
Yeah.
immigrant, especially, I focus on midwives. But as any other health worker, you get information here. I do share my gospel videos, gospel music videos. I share gospel messages, vlogs of myself, health talk, and many other content. Don't forget to hit on the subscription button and the notification bell so that you don't miss any of my videos. To my return
That's,
subscribers, thank you so much for always coming back to watch my videos. And Dylan, thank you so much for coming.
thank you,
I'm going to
Justine.
share your Facebook link, your Instagram link. Dylan has lovely, vlogs of himself on there. You'll enjoy it. He's got lovely pictures. I always enjoy looking at your pictures on Facebook and
Thank
Instagram.
you.
Thank you so much for joining me
No
today.
problem. It's been a pleasure.
Guys, until we meet in my next video, it's
Bye.
bye.